Hello, I'm Darren. We have breaking news. More than 600,000 Americans have kidney failure. While the number of people with kidney failure is enormous, the number of people with its precursor, chronic kidney disease, is staggering. An estimated 31 million Americans, or about 10% of the US population. Diabetes and hypertension cause 2/3 of all cases of kidney disease. 1 out of every 3 Americans is at risk for kidney disease, and kidney disease is now among the top 10 causes of death in the United States. In addition, 9 out of 10 people with early to moderate kidney disease don't know they have it, putting their health in jeopardy. Are you at risk? For more information, contact urbankidneyalliance.org. The life you save may be yours.
Well, good evening. Welcome to another broadcast, Mental Health and Me. I am Steve Belcher.
And I am Sade Cutler.
Hey, what's going on, Sade?
Nothing much. How are you, Steve?
Okay, we caught you off guard again.
No, not at all. I'm ready.
Hey, I hear you. I like that plant behind you.
Thank you.
What kind of plant is that?
It's a Chinese evergreen.
Okay.
Yeah, that's what it is.
Let me ask you. Hey, what's going on, Tay? How you doing, buddy? Let me ask you, do plants, does that help if someone is dealing with a mental illness? With plants and greenery, would that be kind of assistance to mental well-being?
You know, that is so funny because in the holistic world, absolutely. Plants are just so Uh, they are amazing for healing. So I definitely, when I was sick and going through different things, plants were a big part of my healing. They help with breathing. They help with just like cleansing the air. So sometimes when you are feeling depressed, sometimes you feel like a little claustrophobic, and it may not even be really hot, or the air might just feel a little thick. To increase your environment with more plants is definitely a way to help with mental illness.
Oh, wow. That's awesome. Guys, share this broadcast again. You're not going to get any type of information unless you go to a webinar with one of these organizations. But share this broadcast so other people dealing with chronic illness, kidney disease in specific, tune into this show. I mean, mental illness is nothing to play around with. It's nothing to be ashamed to talk to someone about it. In fact, that kind of leads me to tonight's show of Mental Health and Me. Sade, we talked about depression and anxiety over the last two shows, what it was, how it kind of creeps up on people. And now tonight, hopefully we can get through it. We may have one more show, but that's okay, because the more we talk about it, the better. I feel.
Yeah, absolutely. We help to normalize it so people can understand that they aren't alone. Sometimes our mind can begin to play tricks on us. So we'll be going through something and think nobody else understands or nobody else can empathize with us, but it's just simply not true. There are so many people that are going through a plethora of mental illnesses, and comorbid mental illnesses. So this is the platform to come. So we can
Absolutely.
you know.
I mean, we have a professional that deals with this on probably a daily basis. But so, Sade, where we left off on the last episode, we left off at how depression and anxiety can affect you or me or anyone. And what they say, it starts off by saying depression and anxiety can affect how you make decisions regarding your treatment. Now, in this conversation, we're talking in the aspect of chronic kidney disease. And when we talk about treatment, we're referring to dialysis treatment for people who are watching. But you can apply it to any disease that you may be dealing with and place whatever treatment that you're using for that particular chronic illness or disease. But in this aspect, we're talking about kidney disease. So it says depression and anxiety can affect how you make decisions regarding your treatment. As a patient on dialysis is actively involved in their day-to-day treatment regarding fluid intake and diet, you need to have a clear mind in order to make the best decisions. Depression and anxiety can cloud thinking, make decision-making difficult. They can mean you put off decisions or even make unwise ones. Now, with that being said, how would one distinguish if they have the cloudiness thinking because of inadequate treatment, or is it from depression or anxiety that could be clouding that thinking? Is there, like, I guess maybe a physical symptom that can distinguish the cloudiness thinking? How would one determine if it's the treatment that's causing it or anxiety or depression?
So when in situations like that, you typically have to do an assessment. most of the time, depression symptoms, anxiety symptoms can show up and look like actual chronic illness type of symptom. So those is the times when we look into like the questions about medical questionnaires. Like we might have to refer them to the doctor to see what the doctor says. And then on the mental health part, we may ask certain questions about how long they have been feeling it. We may have asked certain questions about other symptoms they're having. Are they having any symptoms of suicidal ideations, any hallucinations, feelings of sadness, tearfulness. Like we start to get a little bit more in depth with the questions to try to like correlate where it could be coming from. And that's how you can better gauge if it's more so the mental piece than the medical piece. So even when it gets to the medical piece, we may say, well, when did you start feeling like this? They might say, when I was in treatment and I left that day, I didn't feel well. So sometimes that can kind of pinpoint the beginning of the symptoms versus if they say, I just feel like this all the time. It just started when my first day I came to treatment. Then we got a little bit more to go on because we know that the time frame has been longer, lengthier, and that's when we go to like dive into the more in-depth questions.
Guys, share this broadcast, please. I can't tell you and stress enough that no type of information or program is on the internet. And speaking of the internet, go to our new channel on Stream TV where we have our own channel and you can see it's 24/7 rolling. So
yes.
guys,
I'm so excited for you, Steve. That is like awesome. You're doing big things.
Thanks, Sade. You on there too.
Yes. But I just think that you're doing just such an amazing job with just everything, like with the content, with the shows. It's just awesome, and it's really what we need. It's what
absolutely. We need. Thank you, Sade. I agree. We do need something like this. And we need more participation. We need more warriors to find out about this so they can benefit from the work you do because you do amazing work. I mean, and so if no one knows about you, I mean, then the information can't get out there. So let me ask you this, Sade. When you worked in dialysis, have you seen how depression and anxiety can affect somebody's decision making and treatment? I mean, I've seen it, but I didn't put the two together at the time. And what I mean by that, for instance, a patient may come in and he may be upset and we don't know why, and he may get on, and then maybe an hour and a half into treatment, something small could happen that really not really a cause to really go off, but something small could trigger the patient to go off, and he's like, take me off the machine, and you don't know what's going on. Have you seen anxiety rear its ugly head in that manner where patients put their health in jeopardy and made poor choices because of that?
Absolutely. It's like, you know how some people have their real high highs and their low lows. So sometimes a situation that others may think is not that serious or doesn't cause for that type of response could be it could be something like small just because they came in and let's just say that the nurses and the techs didn't get them on the machine right away or something like that. And they just go off and say, I just don't want to get treatment today. And it's not directly related to the person or what happened. It's just the stress and the nature of their mindset and the place that they're in. When you are dealing with depression, it diminishes your focus, your concentration, and it really can alter your decision-making skills. So when a person would rationalize a little better with something like that, like being late, other people might be ready to go completely off. Just like when you see people that are anxious about certain things. You're like, well, why are you anxious? Nothing going on. Like if they're going on an elevator or something. And other people might think that it's just a typical experience of getting on an elevator, but in their mind, they're having anxiety, they're panicking, they feel like they can't breathe, and it seems like something is about to happen. So there are so many extreme lows and extreme highs when you're diagnosed or you're dealing with depression and anxiety untreated, especially that your decision making skills can they just can vary from day to day.
Wow, that's crazy. And then maybe some warriors may not even be aware of that. Have you seen
Absolutely.
that?
Absolutely. Like sometimes that's when we start to see more of the crisis, when you start to see people like crash into therapy and they might be hysterical, they're crying, and they're asking you like, what happened to me? Like, I don't even know what happened. Sometimes people start to make such irrational decisions that they don't even remember making a decision. You know,
Mm-hmm.
they are just completely out of it. Sometimes they just black out because they have harbored so many feelings and suppressed it so deep down that they're like operating in a numb state.
Mm-hmm. Mm-hmm. Wow. I'm sitting here trying to figure out how to start a watch party and share. But wow, that's incredible. Now look, now it says depression and anxiety are not good for your physical health generally. They can affect immune function, making you more vulnerable to illness and infection. People with depression and anxiety report more general physical discomfort and see their GPs or general practitioners over twice as often as the general population. They may also affect how well people respond to dialysis. What do you say about that?
You know, that's one of the biggest areas that how can I the best way I can describe it is it could be a little frustrating because people they have depression and they have anxiety and they seek more medical attention with their GPs, and it's not a situation that's quite on the patient's end. It's more so sometimes on the GP's end, because if you see that a patient is coming to you and they're experiencing depression and anxiety, you need to send them to the specialist, which is us. Send them to us. And a lot of time they don't make the referrals as needed. So many people, even in the medical field, believe that you can just get over depression on your own. And as we stated before in the previous episodes, yes, some people can have just a week of depression and be completely okay without any treatment. But there are some that need treatment right away. And if they do not get treatment, they get worse. So it is so important for them to actually refer to the mental health providers when they come in there, because the truth is that they do. Sometimes I get patients that say that they've been dealing with depression for like 7 months and they went to their GP and they got some medicine from the GP, it's not working, and they're here. Whereas though they could have got medicine from the GP, but the GP could have also did the referral to us
Right.
for therapy so we could tackle this thing together. We can make them both work together. So the medicine is going to work on the chemical part of you biologically, and then we work on the mental part of you, like the inner part of you, to make it all come together. That's usually how it works, and it does work.
Mm-hmm. Now, I can see that being a ball of confusion because it says depression and anxiety are not good for your physical health generally. They can affect immune function, making you more vulnerable to illness and infection. Now, if you got someone who just started dialysis, they got a catheter, and maybe got catheter issues, and they're not getting a good treatment, and they depressed and anxiety. I mean, it almost seems like that could add to the decline of their health.
Yes. And it can add to the decline of health drastically too. Like it so where you are really adjusting to your new body, the new functioning of your body when you are dealing with dialysis and kidney disease. Many times, if you are also dealing with depression and anxiety, like there are certain it's so many different pains and stuff that can come along with it. It's so many different bodily function, like stomach pain, that can start from it. So you definitely can have a decline in health. So that's why it goes back to being important to getting both professionals to do assessments on the patients, to be able to differentiate where it's coming from. If a person starts to get treated medically, their baseline will become a normal. Like, you might be able to check certain things for where they at. Like, say a person was feeling really fatigued and they were anemic. So then you start to treat them for their anemia, and you check their levels, and now their levels are normal. That will also, and they're like, well, I feel better, but I'm still tired. Then we can kind of cross out that medical piece, and we can deal with the mental piece of it. So now we know there is no medical condition right now that's causing the fatigue. You're cleared on that. We're going to focus on the issues that could be contributed to it in the mental aspect.
Wow. Guys, Sade Cutler, master social worker, clinical licensed social worker, head co-host. We're talking about how depression and anxiety can affect you, especially people with chronic illness. Again, share this broadcast. If you're in multiple groups, share it in groups, because we know maybe not all people with chronic illnesses have depression or suffer from depression or anxiety, but it damn sure affects a lot of people.
Absolutely.
And we're going to be here talking about it each week at 7 p.m. Eastern Standard Time, USA. So, guys, share this video. Be here on Wednesdays if you want to, sit on your couch, lay back. You got a licensed social worker that you can ask questions about and get honest feedback in real time. We're not going to have you answer the questions and keep talking and move past it. I see the questions. You sitting on your couch like if you was in the psychologist's office. You get comfortable. You ask Sade. She'll give you her suggestion. However, anything you do, you have to seek, medical opinion. These are our suggestions. And Sade, before we go on, I got to remember to keep doing this to protect yourself and me. Is that information on this show and any show on the network on Urban Health Outreach Me is provided for education and informational purposes only, and it is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. I mean, with that being said, if you like what you hear from Sade, she's licensed. You can reach out to her on her email or Facebook, and she'd be more than helpful to talk to you about what's going on with what she do on the side.
Yeah,
absolutely. So Sade, it says people who are anxious or depressed are less likely to get out and exercise or to do everyday tasks. Their ability to communicate and express emotion may be affected, placing additional stress on family and friends as well as themselves. So how important is that to, again, people who suffer from chronic kidney disease? They first get diagnosed. We know they're going to probably have some medical issues that affect them with fatigue and stuff. But once they move past that, even though exercise and getting out is very important for their well-being, how can they push through that if they're dealing with anxiety and depression? How can they get on that fast track to exercising and get back to doing everyday tasks?
So when you're in therapy, you are really working on your whole self. So sometimes you have to really educate the patients or the clients on what is happening, because some of them may not be aware of exactly what their body is doing or what their mind is doing. So when you talk to them and explain to them that the feelings that they're feeling are normal, a lot of people have no desire to participate in their activities of daily life when they are battling chronic illness, yet alone battling depression and anxiety. You actually don't feel well enough to do it sometimes. And in the mind, your serotonin levels, like your happy hormones, are decreased and lessened. So you're physically affected by it too, because you literally just don't feel happy or motivated to do those things. So you work from a little bit of CBT techniques, which is cognitive behavioral therapy, letting
Mm.
people know that your thoughts affect how you feel, and what you feel affects what you do. And when you take it back there, you really are trying to get people to change their thoughts and their mindset at the beginning when those thoughts come in. And usually it'll start to make them or help them get motivated to do certain things that they were doing before. And also, sometimes you have to start small. Like, say that you used to go to the gym a lot and you no longer want to work out because you feel depressed, and you're battling kidney disease and any other chronic illness. You may say, okay, I used to go to the gym a lot, but let me just try to get back to it. And you might say, let's just do one day out the week. Let's start small. So you start to start where they are. You meet the patients and the clients where they are to help them get back to what they used to be.
Hmm. You know what? If this also affects their ability to communicate and express emotion, may be affected, placing additional stress on family members, friends, as well as themselves. So if somebody has a spouse and they got depression and anxiety, and it's affecting their ability to communicate and express their emotions, and then the spouse may also be dealing with it, how would you know if the two are suffering from depression? They may look at it, they could end the relationship thinking it's something else and not knowing that it's depression or anxiety behind, it's the driving force. Like, for instance, maybe the person that has a chronic illness, maybe something happened, and then the other spouse, they've been together for such a long time, and then, like, I can't take it, or something like that, or a verbal outburst over something petty, but
Mhm.
underneath it could be depression or anxiety. But my point is, if both of them are dealing with this, and both of them could be dealing with ability to communicate or express the emotions, then how can the two come together to be treated if they can't even express to each other what's going on behind the anxiety and the depression?
This comes into the part where we see a lot of relationships decline. They don't know that a lot of services, first of all, some of them don't know that they even need it. And then some people don't know where to go to get it. And then some people don't know where to start. Um, with the couples, it's such a that is such a special area, because a lot of times couples that are in relationships, marriages, and they have one, their mate, their significant other, um, gets diagnosed with a disease, they really don't know what to think, and they don't really know what to happen. And sometimes doctors can tell you one thing, and things sometimes look different on paper. Like when you tell somebody, oh yeah, you're gonna live, you just got to get dialysis, you have to get those. Sometimes they don't get into the nitty gritty of it and how it affects so many areas of your life. So when we go into the couples piece, the way that it spills over into the couples and causes a lot of problems is, if I am under the impression that you are diagnosed with a chronic illness, but it's not going to be, it is it can be life threatening, but it's not a death sentence for you, then my expectation of you may still be the same. I might be a little sympathetic and empathetic to you, but I still expect you to do certain things. So when you don't know that your sex drive is going to go down, you don't know that you may experience an heightened depression and anxiety, you're not prepared to deal with those things. Then when those things happen, they affect these couples' love languages, like the love languages of like acts of service, words of affirmation, physical touch. Those are the ways that a lot of people end up connecting with their mates. So when you really think about it, you have this couple diagnosed with this chronic illness, and now they don't feel beautiful about themselves, or they feel weak, or they feel sick. They don't touch their partner anymore. It's not that they don't want to touch their partner. It's not that they're not attracted to their partner. They physically don't feel well enough to engage. So then the opposite end, the partner is thinking, "Dag, I just feel like you don't touch me anymore. It just feels like our love life and our intimacy has gone down." So when you go deeper in the therapy piece, you have to get really deep and make each other understand where they're coming from. It's not that I don't understand that you're sick. I get it. It's just that my love language is now affected by what this diagnosis is. So then you have to work from there. It is so deep, and it goes so it goes so wide and long, and it varies. Just like financial stability, some people look at their mate, like if it's a husband that ended up on dialysis, as a provider, and you have a woman that may have been an at-home mom by choice, and for both mates, they liked it like that, and then all of a sudden your spouse crashes in on dialysis, and he's battling his job, and he loses his job, and now the finances are messed up. That security that you once had is not there. So that affects the love life too. It's not that you don't love your mate. It's just that life is just different now. And it's a drastic change.
Mm-hmm. And let me ask you this. Would you suggest anyone, maybe married or not married, as soon as they are diagnosed with a chronic illness, that the doctor should refer them for counseling, especially ones that are married, because it would be very important for the mental health practitioner to let the couple know what to expect, since this is their new normal now. What is your thoughts on that?
I really think that should come in like a package type of thing, where I think it should be treated as a preventative measure, and I also think that it should be treated as like a premarital type of counseling thing that most people get before they get married, like an introduction to kidney disease or chronic illness, even if it's just like 2 or 3 sessions. It doesn't even have to be anything that you commit to weekly, like some people do. It could just be an introductory type of therapy situation where you do an assessment and you kind of gauge how the couple will fare or how well they'll do with the diagnosis. You can even do like pre and post type of tests, get to know the things that matter in their relationship, to kind of like help them build on the things in the areas that could be affected once this treatment starts. So I'm like, I am 100% on board with pre-counseling before you start to get on dialysis or any chronic illness. I think
I got a comment from Adrian A. Hopkins. Thanks, Adrian, for a comment. I appreciate it. And maybe you can address this because you worked as a social worker. He says, "Hey, everyone, question. What kind of specialist are you referring to?" I'm not sure on what, but psychotherapist, if we were referring to something we were talking about pertaining to mental health specialists. And then he says, "Can you speak on antidepressant pills?" I know you're not a doctor, but maybe you can address what knowledge, your opinion on, and then are they good or bad? When I was deep into my depression, my social worker was arguing me to get on antidepressant pills and go check in a mental hospital only because I refuse to talk to people at the dialysis center. Have you, I mean, is that common for, I mean, I know you can't speak for all social workers at dialysis center, but when you see something like this, what comes to your mind as a ex-dialysis social worker when you see a comment like that?
Okay, so the first, all right, well, so it's a couple different parts of that question. So the specialist they are referring to, I guess, when they're telling you to go to the doctor or try to get antidepressant, your GP can give you stuff, but typically you will go to an actual psychiatrist to get prescribed medicine, or a nurse practitioner, a psychiatric nurse practitioner can prescribe medicine. Social workers do have influence on medicine because they're doing the therapy piece, and sometimes they make recommendations for the doctors on what they think, so they coordinate that care together. As far as what he is saying, my views on antidepressants is there is danger with any type of medicine that you take, period. That's just
Absolutely.
what there is. However, some things do more good than harm when needed, and some things do more harm than good when needed. So that's why you definitely always have to seek medical attention from your medical provider. But with that being said, I am not against or for antidepressant. I am very individualized when I use it, because I have had to tell people that they may benefit from an antidepressant.
Sure.
And it can be a short-term use. Sometimes the chemicals are just off a little bit. Those SSRIs help it, like your serotonin may be low, and it can help just to balance it off a little bit to get you back into a better space and get you over the hump.
Sure.
That's just what it is. That's just the truth of it. It can do that. That's what they are made for. Do they have side effects? Yes, they can. Sometimes people do well on them, sometimes people don't. Sometimes you have to sometimes you have to get adjustments on them with the dose, or different brands or different types and things like that, which goes back to you dealing with the actual specialist that he was asking about, which would be the nurse practitioner, the psychiatric nurse practitioners, or the psychiatrist. So the other part of it is, the expectation is that you do speak to your clinical team when you are at dialysis. Because you are getting such a serious treatment, that your social worker will want to talk to you, just the same as you, Steve, being a nurse. You know that you understand that people might not be in the mood to talk, but it would benefit if you're trying to get what you need from them, or you're trying to get certain things done. I can't speak because I don't know everything that happened with that situation. If you weren't talking to the people at the facility, I don't know if that would be my first go-to. But however, if it was causing you to shut down, other things and factors will play into it that could be different and that could change. So the expectation is, yes, if I was your social worker at a dialysis clinic and I was trying to talk to you about certain things, I definitely would want you to talk to me. That's how, so I can help you. If you aren't talking to the staff about such a serious medical treatment, then people will assume that you might be depressed because you're not dealing with whatever is going on, or you're not openly communicating about it. So in efforts to get you where you need to be, I would want you to talk to me, because I might need to refer you to a mental health provider like me.
Well, let me ask you something. Could also what play in the factor, could the social worker per se could have a attitude, like a condescending attitude? I mean, could it be the attitude of the person? Like I'm just saying, if I was in AHOP's place and I'm all of a sudden I'm on dialysis and I'm going through something, and let's just be real. Let's just say, I'm black, AHOP is black, and let's say the social worker is white. And she doesn't understand my situation. We know, a lot of people of color have disparity or whatever, something going on. And you may come and try to talk to her about that, but they may try to, play it off, or maybe the way that they respond, I can get a feeling like they not taking me serious, and to lead me being more frustrated with the professional person.
Absolutely. Social workers, psychologists, therapists, clinicians, whomever, are not exempt from being jerks or being rude or being condescending or being racist or being any other thing that any other profession can be. Some people are in the profession, don't like what they do, don't care about what they do, don't even like the people that they serve. So absolutely that can happen. And I'm realistic about it. I've seen it happen a lot of times in different areas, different sectors and everything, with people that hate that job. They hate what they are into. They don't like it. So they can be very condescending, judgmental. They misdiagnose. They don't care to do a thorough assessment. They're not competent with culture. They can't connect with people. So all of those things can factor in for somebody to say, hey, like just go get some medicine or something like that, and being rude to it. So absolutely, that can be.
Wow. Okay. Hello to Shazmar. Thank you for watching from YouTube. I appreciate you. Get some more people to subscribe to our channel, Shazmar. You'll be our #1 fan over there. Thank you. Now check this out, Sade. It says some of those affected by depression and anxiety are also more likely to engage in risky behaviors, in particular, excessive use of alcohol. Now, let me just share a couple of things. And again, I didn't know that maybe the person, depression could be tied into this. But I have known patients when I worked at a DaVita dialysis, and I don't work for them, so I can say the place and everything. It was a DaVita dialysis, downtown dialysis in Baltimore City. And I used to work there, and it's in a medical professional building, and they had patient bathrooms inside the unit and outside on the floor of the medical professional building. Now, there used to be patients get off the machine, go into the bathroom and shoot dope, and take a hit off the crack pipe, and they'll come back into the unit, and you can tell and see the change. I've seen patients at DaVita 25th Street in Baltimore. I've seen a patient get off the machine and walk across the street where it's a liquor store directly across the street, no more than 20 feet. Go over, get off the machine. Not his time was up, but halfway through the treatment, take him off. We can't say, no, you got to stay on. He got off, right? Said he had to go to the bathroom. He got off, went out, went across the street to the liquor store, came back, sat in the lobby, drunk the liquor, peed in the lobby, and then came back to try to get back on the machine. Now, how insane is that? My point is, mental illness had to play some type of part in these decision makers, where a patient get off the machine, go into the bathroom of this building, outside the dialysis unit and inside the dialysis unit, inject heroin in their catheter, and also smoke crack. And for a patient to get off the machine, to walk across the street, to buy some liquor, come back, drink it, urinate in the patient lobby, not in the bathroom, but in the lobby in the corner, and then try to get back on the machine. So depression, anxiety, I feel plays a big part in that. And these patients weren't schizophrenia or to that point, but is that possible that depression can cause those type of behaviors that I just mentioned to you?
Well, yes. People that suffer from substance abuse, they are typically dually diagnosed with depression, anxiety, and with alcohol abuse and substance abuse. You understand, like, just because you get diagnosed with kidney failure and end up on dialysis doesn't change if you have been addicted to heroin and you are used to shooting up at certain times and things like that. That is a separate treatment in itself. So for a patient to get off the machine, honestly, it's not even that far fetched for what we see, because sometimes they stay on the machine, they might start withdrawing, and the behaviors can get even more dangerous. So sometimes if they don't get off the machine to go take that hit, not that you're encouraging it, it could cause a whole
verbal
right
verbal outbursts, all kind of stuff, right?
All absolutely. And even with the alcohol, the funny thing is, being addicted to alcohol is one of the harder ones to shake when you're trying to be sober, or like when you're trying to clean up from that. That is very hard too. So for a patient to get off the machine and go take a drink, that's certainly a problem. Now, peeing in the corners and things like that, you see that when people are so inebriated. Of course, that is that's even an effect of you being like what they say, pissy drunk, literally pissy drunk, or whatever. But it's also go hand in hand with mental illness. They come together. So you can definitely see those type of things happen. A person can be on a machine and have an urge, a trigger, a craving, and next thing you know, they like, Steve, I need you to take me off. And you're like, what's going on? But if they don't get off at that time, it's like they might start ripping the stuff out the arm. You don't know.
I seen that. That.
See?
Yeah. As you may say, all hell may break loose.
Exactly.
Wow.
It can get real quick.
Hey, and you know what? I got happy. Shazmar, that's Shamika Small. What's up, Shamika? I thought it was somebody from overseas. I was so happy. Not that I'm not happy as you, Shamika, but I thought because of the name that it was somebody from India or something like that. So, all right, let me move on. We don't have much time, but it goes on to say depression and anxiety may affect physical health, lead to managing CKD treatment poorly, and even cause disagreement with family and friends. There are many reasons, therefore, for seeking diagnosis and treatment. And that's true, because a family member may see someone who may be depressed and say eating a lot of bananas. They used to like bananas, and they know bananas can cause a cardiac arrest because of the potassium. And the family member like, what are you doing? And that's a disagreement right there. Like, I know what I'm doing. I'm going to dialysis tomorrow.
I'm grown. I can eat what I want, Absolutely. And sometimes like friends and family take on those emotions with you because they want you to get well, or they know what you're going through, and they know what you're at risk of when you engage in behaviors that you're not supposed to. So it wears on them. Like, sometimes they want to get out of a situation, but they know that they would feel bad if they just wash their hands completely of it. So that can be very taxing on them. And sometimes manipulation can come in. When you have some people that are chronically ill and they don't want to follow certain guidelines to improve their health, their loved ones feel kind of like in bondage sometimes. They feel stuck and just emotional roller coaster, because they feel like if they say something, it's going to cause an argument. But if they don't say something, it's going to cause you your life.
Now, Sade, before we move on, let's be very clear on something. I know we've been talking about anxiety and depression and how it affects someone with a chronic illness. In particular, we were talking about kidney warriors or person with chronic kidney disease. But with that being said, you don't have to have a chronic illness or kidney disease to suffer from depression or anxiety. You can maybe have back pain or arthritis or lupus or diabetes or hypertension or any other kind of health situation, or maybe not, and still deal with depression and anxiety. Is that correct?
Absolutely correct. Absolutely correct. You don't have to have a diagnosis at all to feel depressed and feel anxious or suffer from anxiety. You could just be sad. It can be there's seasonal depression just because the seasons are changing. When you are about to transition to certain things in your life, there are so many different things that can just cause a person to have depression. A breakup, lose your job, expectations that you had for certain things, dreams that you had, not being able to find a mate, children issues, like everything. Anything can cause depression. Anything.
Oh, and let's not forget
Anything.
the number one thing that's probably have people depressed nowadays, COVID-19.
Yes.
Especially when it first came out, people didn't know what was going on. You heard 5G, martial law. That's why I didn't pay attention to TV, because I don't look at the news, because the news can make you depressed and anxiety, right, Sade? You hearing about all these murders, and you're seeing men of color getting gunned down by police. That can cause depression, anxiety. You see other people, injustice being done. It can cause anxiety and depression because it makes you want to say, oh, that's wrong. And I know for me, if I see something that is injustice, it does something within inside me. And I have to, like move myself back and pray and turn it over, because I'm powerless over anything that happens outside of myself.
Yes.
I can't do nothing. I'm powerless over people, places, and things. That's something that they taught me in recovery. So do nothing outside of yourself. Is that true, Sade?
Absolutely. Watching the news and all of the stuff that's going on definitely contributes to a lot of depression. That's why sometimes therapists may tell their clients that they may just need to just disconnect for a moment from like social media outlets, because it's too much for people to just grasp. And like you said, with the killings that are just being like plastered all over social media and things like that, that is trauma. That causes trauma. You sometimes you get clients come to therapy because of racial trauma, and then you have historical trauma. Some people are still traumatized because they saw certain things happen, or just because the history of a culture or a race and things like that. It is like it can cause PTSD. Sometimes people don't want to go out because they start to look at the world differently. Is it instilling fear in a lot of people, or when people watch those things, cause a lot of fear, and that's when a lot of anxiety comes as well. It's just that is a big domino effect.
Mm-hmm. And so, next week, I told you this is a long topic, Sade. When I told you when we first thought about the show that depression, anxiety was probably going to stretch over some shows. But next week we're going to talk about there is hope to all this.
Yeah.
And that's the road to recovery. Yeah. And next week we're going to talk about that. But let me just see what Tori said about substance abuse. Unfortunately, people have to be ready to accept that substance abuse is a problem before they seek the help and treatment they need to recover absolutely from their addiction. All we can do as their friends, loved one, is to be there to help them through recovery when they're ready. Recovery on their own time. Now, absolutely, and I had to learn that. You can't recover for no one else other than yourself. You can't go into recovery for your mother, for your father, for your brother, your daughter.
You gotta want it.
You gotta do it for yourself. So
Absolutely.
With that being said, Sade, before we leave, just again, as a licensed clinical social worker, just speak how important this show is, not just for people who suffer from chronic diseases, but for people in general that may be hurting in the world that we're living in today. A COVID world, a world of division, race, people are upset. Any little thing could set someone off. If they're in the store and someone has a mask and someone doesn't, how important is a show like Mental Health and Me is important to not just the urban population, but the population in general across this world?
So right now, the state of the world is in a very, very odd and divisive place. And with COVID, a lot of people are experiencing heightened levels of depression and anxiety. So a platform and a show like Mental Health and Me gives people the space and opportunity to relax and talk about many different experiences or feelings that they are having at this time. It gives a lot of opportunity for people to engage and normalize what's going on in the world right now. Although things are not normal, normalizing it means to be able to talk about everything that's going on, to be able to express what's going on and know that you're not going through it alone. So that is what we would like to see this show do. And sharing it allows other people to know that they're not alone as well. They get to tune in, they get to enjoy, they get to engage, and we need some happiness right now. That
absolutely. We need to smile more, laugh, unity, unify. And again, I can't stress this enough. There's nowhere, it may be, I don't know, but there's nowhere I've seen on Facebook where you have a licensed clinical social worker who is licensed and practicing, able to answer your questions with knowledge and evidence-based information. You're not going to find another social worker devoting an hour each week and giving back to the community. A lot of those social workers trying to, make some money and build Medicare or insurance companies and do their work. They ain't got time to be coming on some shows each week, but you have one right here that is giving back. She's from the community, giving back to the community. You graduated from Coppin.
Yeah, I did my undergrad at Coppin, and I did my grad at University of Maryland in Baltimore.
Oh, absolutely. I went to University of Maryland Nursing School in Baltimore, right across from the hospital.
Mm-hmm. Yep, I was down there. That's where I went for grad school, and Coppin was undergrad.
Yeah, so guys, again, we're bringing it to you. All you need to do is share. Come and get the information. It's like having your own personal social worker each week to, again, pull up a chair, get your couch, lay on it, put your laptop on the table, get your pillows. If you got popcorn or any other stuff.
Yes.
Just come in. I mean, it's no judgment, just like Planet Fitness. It's the no judgment zone. Yes. So come on in. Talk what you want. If we see somebody judging somebody or any type of blame, we could block them. But we don't want to do that. We just want to help people.
A safe space.
Exactly. A safe place. And one more thing, Sade, before we go, because we got Warriors Quest coming up at 8:30 with host Jared A. Brown.
Okay.
But what I wanted to say, this is also important because of the new platform that we created on Stream TV, where you got the shows rolling 24/7. So if you go to this website, Stream TV, on the links that we post, you can't pick a show that you want to watch right now, but we're going to have video on demand. However, you can watch that channel and see some of your favorite shows that may be coming on. You may see Mental Health and Me from 5 to 6, and then at 6 o'clock, Warriors Quest may come on, and from 6 to 7, then from 7 to 8 may be Uncle Jim, and then after that, it may be Lisa Baxter, and so on and so on. And I'm happy to announce we just added one more channel, the music channel, which is Positive Music. You go on there, it's enough music on there that's streaming 24/7. All types of positive music. And Sade, check this out. Next, we want to add the Urban Health Outreach Media Faith Channel. And so I've been reaching out to some pastors. They haven't even got back with me, to stream or just some positive message. We're not trying to force any type of religion. That's why I said faith-based. We just want positive message and insight to be on that Urban Health Outreach faith-based channel. So people could come and have 3 different channels that they may want to see or to pick. One day you may want to see the Urban Health Outreach Media channel to get health and education. One day you may feel like listening to the music channel. It's a channel design where there's no cussing. It's just positive music, upbeat, uplifting music. Then you may want to go on the faith base, and you may want to hear. I want to try to get my some YouTube tapes of my cousin. He's an archbishop down in Virginia, Raymond Odie. Get some of his content and maybe get. I think Lamont Reed is a minister, and some other ministers out there, Willie Blackwell, and I may be missing someone, Pastor Haywood Pruitt, and Gregory Jackson, and anyone else who may have YouTube contents of positive messages for a sick world right now. We definitely need and we want you on that channel, the Urban Health Outreach Media Faith channel. So that's in the works. So we're trying to do a little, we're trying to do big things.
You are doing it.
Look, big things in a small environment. Right now I'm in my basement. So, like they say about Vegas, it's the biggest little city in the world. So that's what we're trying to do here, be the biggest little urban health outreach media company there is. So
I have not seen anyone as dedicated to their dream as you. You are doing it. We are claiming it. Like I am.
Yeah, we're going to claim it.
Yes.
I don't have nothing else. I mean, when you've done dialysis like 33 years out of 56 years of being on this planet, that only leaves 19 years or something like I don't know, but that time frame. So I've been doing dialysis for the majority of my life, and to automatically one day go to work like it's any other day I go to work, and to my career to be ended from a accident that was no fault of mine, but the fault of the company with this leaking acid and not addressing the maintenance of that. I unfortunately lost my career over an injury. However, I gained a new career in advocating for people with kidney disease, and just to let them know what's going on behind closed doors. Because as a former employee yourself, and I know you can't talk too much on it, but I can talk on it, that DaVita in particular has no good in them as a corporation, but the people who work for them, the line workers, the nurses and the technicians, just like with any career, you got good ones and you got bad ones. That's where you get the care from the line workers. But better bet the people that administrators and above, only thing they got on their mind is getting those numbers down, getting those numbers, making productivity. That's the only thing on their mind. So I'm not going to bash them anymore. I just wanted to let people know that shows like this are very important, and that's why we create them. We know that the units are short of staff at some places, not all, but a lot of times they ain't got time to do this education no more because it's about getting patients on the machine. Because each time that blood hits that dialyzer, that's another dollar in the that's another cash register going off. Just like on It's a Wonderful Life at the end, that Christmas show. It's a Wonderful Life with Jimmy Stewart. Yeah, and at the end the bell went off, and the little girl say, "Look, Daddy." When the bell rings, they say an angel got their wings. But in this case, when the bell goes off, Fresenius and Davida and got money in their pocket. So with that being said, thank you guys for watching. Tune in next week for another episode of Mental Health and Me. Sade, you got any last parting words before we go into the night?
I just want to thank people for tuning in and continue to watch whenever you can, even if you do miss the live. And just be encouraged, and we're here every week.
Oh, absolutely, without a doubt. And just before we go, I know you got some projects going on. Share with us so people can support your other projects that you got going on, because you deserve it. I swear, I don't feel like, if I was on dialysis and if I was watching this show, I'd be like, damn, how come she couldn't be my social worker? I mean, I would be saying that and be reaching out to you on Facebook, like sending little short things, because there's not a lot of people that cares such as yourself. And so please share other projects that you're doing with the community so they can support you.
So right now, as we always talk about, I am the owner of my organization, My Empowering Impact, where I provide therapy and coaching to individuals, children, and families that are in need of mental health services. I also just recently released my story on the podcast of Seeking the Joy with my experience with my pregnancy journey. And my specialties in work are chronic illness, of course, kidney disease, pregnancy-related trauma, complications, postpartum, and grief are like the specialty areas. I'm able to provide in all of them, but those are like the specialty ones. So I'm doing a lot of work and support around this arena so people can get the services that they need.
Damn. And let me just add one thing to that before we go. You got women who they're not, what's the word I want to use? Oh man, my mind just went blank. But you have women that are on dialysis that get pregnant. And so I've seen that many times, and they got to go to dialysis 5 times a day. 5 days a week or 4 days a week. And that could be depressing and anxiety for someone to have to do treatment that many times a week for 38 weeks, 39 weeks, or however long their pregnancy lasts.
Yes, that can definitely be traumatic. And also, when some people have a normal pregnancy and they go in to deliver, you never know what's going to happen on the delivery table, but sometimes they end up having acute kidney failure. So they have real trauma after delivering the baby because their life has drastically changed, not only because they're postpartum, because they develop an illness from delivery. So that's another population right there that it's a wide array. A wide array.
I hear you. All right. Don't worry about it, Miss Denby. Just go back and look at the replay and then share the broadcast as well. And I'm glad you was in Bible study. And tonight is Wednesday. I forgot about that. And see, that's another thing on the channel. On that faith-based channel, I can have someone do an hour Bible study and it could be added up and it could be part of that guide. So, when it's on autopilot, you can have a Bible study from 10 to 12 at night and they get captured. So this is going to be amazing. So you guys just
big things.
Yeah, you guys, that just gave me a good idea with the Bible study, because we can have on that Urban Health Outreach Media faith-based channel multiple people who can submit content of Bible study. And it'll be right there for you. You don't have to go to YouTube or nowhere else. You can go to our network station and have three channels right there: the music channel, the health channel, and the faith-based channel. So with that being said, we see you guys next week. Sade, thank you again. You have a good night. This was definitely a great show. I really enjoyed it. And share it with your friends over on your side of town, Sade.
Of course, always. I'll talk to you later, Steve.
All right, have a good night.
All right, bye-bye.
All right, bye-bye.
Bye-bye.
Thank you.